Okay guys, this is a short instruction video on the use of the axium detachable coil in the treatment of coronary perforation. So what I have here is a caravel microcatheter, so I'll get the camera down to the catheter. This is a very deliverable catheter that we use in retrograde CTO PCI. This and the fine cross have the advantage of being used with a blocking balloon to simultaneously deliver coils through a 6 French guiding catheter without the need for a ping pong guide. So these are the two most widely available catheters that we can use for that purpose in Australia. So if you can imagine that we have our balloon in place, sealing the perforation in the coronary artery. We can bring our coronary wire abutting the balloon, quickly deflate the balloon, pass our wire across, and then pass our microcatheter past the blocking balloon, and then re-inflate our blocking balloon at this point. Therefore, we can work at the site of the perforation with our blocking balloon in place, preventing accumulation of blood in the pericardium. So once our microcatheter is in place, we can then deliver our coil. So here is the axium coil, and essentially you simply pull this back out of the black holding tube and you withdraw your coil that way. The coil comes with a plastic introducer sheath, and this can be kept to allow re-sheathing of the coil if needed. And it's important to note that this delivery portion helps keep the coil coaxial at the base of the microcatheter hub for delivery into the perforation, but does not actually pass through. So it's simply designed to allow introduction of the coil into the microcatheter. You'll then come back and see that there is a plastic tube, the plastic introducer tube interfaces with the actual coil, and this is advanced by either yourself or by an assistant with the plastic introducer at the base of the catheter hub. So this is advanced, and your coil makes its way through. Once you're about midway into the delivery microcatheter, you can withdraw your plastic introducer sheath and continue to deliver the coil. And then you can simply remove the plastic introducer sheath and just place it to the side in case you need to resheath the coil. So you can see that the plastic introducer comes off. There it is. That can be placed to the side, and then you can continue, either you or assistant can continue to deliver the coil toward the site of perforation. So we'll just bring the camera down to the tip of the caravel microcatheter, and you'll see the coil exit. And there it comes. And this can be delivered to any position. And you can, if you're not happy with the decision, you can retract your coil, advance your microcatheter further distal, and then re-push the coil out, so it's fully repositionable. And all the while the blocking balloon is in place through your 6 French guide, preventing further flow. You can also inject through the microcatheter if you need to assess the resolve of the perforation once the coil has been deployed. So once your coil is in the appropriate position, there are 2 ways to actually release the coil. The first way is to use your detacher that comes in a separate kit with the axium coils. And this is reasonably straightforward. You simply place the end in to the detacher, and it will reach a point where it will no longer pass. And you simply detach by pulling the black lever back, and you'll see that my coil has detached, and I can now withdraw the wire and assess the result. So that's quite an elegant way to detach the coil from the shaft. And this is no longer required. It's always good to deliver 2 or 3 coils to the site of distal perforation. So I'll deliver a second coil now, and I'll show you an alternate way to deploy it if that does not require the detacher. So we'll pause the video now for a short period of time.